We're going to talk about now about treatment of leg veins and perforator veins and ulcerations, and proper selection of perforator veins and the proper selection for ulcerated patients. Do we do conservative management first or treat them first? And what's kind of the industry trends. Now, from a wound care standpoint, this is a document summary from the challenges and current practice of management of patients with venous leg ulcers from a wound care perspective. They talk about all the different treatments available for ulcers, such as different topicals and medications, different dressings that are used. At the very end, they say that if it's something that's recurrent and doesn't go away and is severe, recalcitrant, that they recommend consideration of the new surgical procedures to treat it, such as SEPs. They make a mention there's some new laser and radiofrequency procedures. These aren't new, they're 12 years old. And they say that there's a lack of randomized control trials showing that treatment of the reflux will treat these leg ulcers. Well, I'm going to blow that out of the water. This is nonsense. It's been proven actually for the last 8 years that treatment of perforator veins and axial reflux in the face of an ulcer, they resolve in about 2 to 3 months versus 7 or 8 months with dressings. And they come back less than 5% of the time versus 78% of the time treating with the best policy with wound care centers. This is nonsense. There's a pharmacy group as well that talks about this, and they really kind of push on towards the end. Well, you might consider surgery, but in general, this is something that you just treat them chronically with wound care. And there's an FDA paper where they were meeting with different groups trying to figure out what they should be paying for, what should be approved, because there's all these drugs coming out for wound care management. It's a huge exploding market. So we're going to talk about the modern treatment and what we should be doing.